The accurate diagnosis of patients with disorders of consciousness is essential to their management, but can be time-consuming. The second is a validated diagnostic scale designed for time-constrained clinical settings.
The second provides a reliable diagnosis of consciousness within 10 minutes, whereas the current gold standard scale takes nearly 3 times longer, limiting its use in clinical practice.
When learning the seconds, it's essential to follow the administration guidelines closely to obtain reproducible results. For example, by respecting the prescribed time between trials and using the suggested wording.
Before starting a behavioral examination, adjust the lighting of the room to a level that is adequate for performing the exam, and ensure that the patient is positioned comfortably with the 4 limbs exposed and the head oriented as straight as possible. Turn off any TV, radio, or other potentially distracting stimuli. Note any recent changes in medication in the patient's current treatment regimen, with particular attention to sedative and psychoactive drugs. Then select a mirror of a minimum recommended 10 by 10 cm size for a square-shaped mirror, or a 10 cm diameter for a round-shaped one. To assess spontaneous movement, observe the patient for 1 minute, recording any spontaneous behaviors. At any time,